Now let's stay in the area because pregnant women in Kurugu in the West Mamprisi municipality of the Northeast region are forced to walk more than 15 kilometers from their community to access antenatal and delivery services elsewhere due to the absence of healthcare services in their community. Now the community is provided with a CHIPS facility in 2015 but was abandoned without being equipped and has since remained non-functional after the change of government. Now, as a result, pregnant women in labor and other healthcare seekers in the community are bearing the brunt as they are made to travel 17 kilometers through a dilapidated road on a tricycle to the nearest health center in Kurugu for their health needs. Now, speaking to Joy News, some residents expressed concern about the rising cases of women being delivered of their babies in the bushes while on their way to the health center in Kurugu. They are therefore calling for the authorities to come to their rescue. Correspondent Elias Otanko has more in this report.
Kurugu is a large farming community located in a meander of the White Volta River near Kurugu and 23 kilometers away from the municipal capital Wale in the Northeast region. The community since its beginning has been bedeviled by many socio-economic problems with little attention from the state authorities. The community members who live here are poor and largely uneducated, but one of the hard-working groups of people known for their large cultivation of sorghum, millet and maize to feed the nation. One of the most pressing challenges facing this poor community, however, is the lack of health center to serve as source of medical care for the residents. Attempts had been made in 2015 by the then NDC administration to establish a health center, which led to the construction of this CHIPS facility in 2016, but the facility had completely been abandoned after the government of the New Patriotic Party came to power in 2017. In 2020, following a Joy News report, the municipal authorities attempted to equip the facility and operationalize it, but those efforts were aborted after winning again the general election in that year. As a result, pregnant women and children in particular in the community are bearing the brunt as they have to travel on a tricycle and sometimes by walking 17 kilometers to Kurugu for delivery and other healthcare services, whilst emergency services are referred to the government hospital in Wale. Because the health post here isn't functioning, you have to go around to beg for a motorbike anytime you are going for antenatal care. Most often, we walk to Kurugu when we don't get a motorbike. On your way, sometimes you get help by motorists. Those with no access to a tricycle have to travel on a motorbike on the bad road connecting the community to Kurugu and the rest of the municipality. We are appealing to the government to equip the facility in this community to end or reduce our plight on the road. Pregnant women in labor are carried on motorbikes even at night to Kurugu to be taken care of. This 32-year-old woman, Abu Hanifa, says due to the lack of a healthcare facility in the community, she was forced 3 years ago to deliver her baby on the road while on her way to the hospital in Wale for delivery. She's carrying another pregnancy, which is 7 months old now. She says she's afraid of the plight she would have to go through to deliver. Due to the severe pains on that day, I had to deliver my baby on the way. The pains were unbearable, which made me very weak. Even before we managed to get to the hospital with my baby, it was a very bad experience for me, which I do not wish to go through again. Inside the facility, only 2 beds in addition to 2 wooden benches are serving all kinds of patients brought to the facility. In addition, the facility lacks laboratory and medical supplies. 2 staff are managing the facility without a midwife to attend to pregnant patients. Cases are sometimes recorded under this tree. Whilst at the facility, this man was brought there after he complained of being dizzy, and this was how he was attended to. In response, the municipal chief executive for the area, Aremia Osomolaki Basintali, said efforts were in place to address the challenges in the community. He, however, called for support from NGOs and donor organizations.
The best are not enough. What we provided as an assembly on specific to Chiefs Compound is there, but where they are as a remote community, we need to get more beds so that at least they can detain more of the people here. Government alone cannot do the work. We need more support to come. I have about 126 communities in West Memphis. And going around all of them, I have more than 17 Chiefs Compounds in the municipality. It means a lot. Last time we gave them a motorbike and some other material, logistics to start. So as time goes on, we'll try to solve the problem. But indeed, the community needs some support. And I am aware, as the municipal chief executive, we are going to work on it. I will collaborate with the Ghana Health Service to see how best we can make this place an enviable place.
Reporting from Kurugu, Elias Sutanko for Joy News.